Hi, my name is Dr. Stephanie Liou. I use she, her pronouns. I am a pediatrician and National Health Service Corps scholar working on the southwest side of Chicago. I work with a primarily low-income immigrant population, and so for my patients, any barrier that exists in our society is magnified. So teens face so many different challenges when it comes to reproductive health care. So it's very common for me to talk to a teen who had no idea that they could get birth control without needing their whole family to show up and, agree to it. And sometimes these misinformation points are passed on by well-meaning family members or cousins, or currently, it's mostly TikTok where they get this stuff from, and not everything on TikTok is true. Certainly when Dobbs happened, a lot of teens thought that meant abortion was totally off the table, 100%. Judge Kazimierz specifically called out adolescents in his ruling to say that, this is unproven and the risks are, potentially greater. And I just want to remind everyone, there are risks to being pregnant. Pregnancy is a huge health condition, and delivering a child, especially if you are a person of color or low income in this country, is a huge health risk. These recent cases have caused fear. They've, caused folks to question, what is even available to me, right? Or am I going to get in trouble? Am I going to get arrested? And I've also talked with physicians, especially practicing in some of the surrounding Midwestern states, who say, I'm scared they're going to come after me. The mifepristone case really drew my interest, and I got very involved in advocacy around this because medication abortion is so crucial for teens. So when you think about, a teenager who is trying to navigate, this potentially very unexpected, stressful event, having to potentially travel very, very far, depending on where you live, and have a surgical procedure is terrifying. So medication abortions are a lifeline, and they enable teens to safely receive abortions under the guidance of a medical provider and continue to do all their teen things. What I believe is that when I go to tell a teen that she's pregnant, I need to be able to offer her a full understanding of all of her options, and that she needs to be able to make a choice that is not coerced, that is not limited by where she lives or how old she is or her income or her language or any of those things, that she needs to be able to decide for herself and only herself. Abortion can be an act of love. They deserve reproductive autonomy just like anybody else. What I say to parents is, your children will grow up one day, and what you want, or what I hope that you'll want, is that they'll become strong, confident adults who are able to take care of their bodies, who are able to consent, who are able to walk into a doctor's office and ask questions and make decisions about their own health. And that starts with right now. It's not that the switch flips when you turn 18 and now all of a sudden, we're going to talk to you about consent and bodily autonomy and help you feel comfortable in your own body. That has to start from day one.